I am very happy and honored to have Dr. Gold on the X22 Report Spotlight. Dr. Gold, welcome to the Spotlight.
I'm so happy. It's my first time on your show.
Yes, I'm so glad that you can be on it, and I'm very happy to have you here. And I mean, you wrote this book, Selective Persecution, and I think we all saw what happened during coronavirus, where you came out with many other doctors and you started to speak out about what was going on. I wanted to get your view of what happened and what happened when you started to speak out against, I guess, the medical establishment, because you had a very, very different view than what they had.
Yes, we might as well start at the beginning because it's such an interesting story. So, as you mentioned at the top of the hour, was a board certified emergency physician for many, many years, more than 20 years. I happened to have graduated medical school exceedingly young. I was 23 years old. I just mentioned that because, it's a little bit unusual. And because I was young and interested in a lot of things, I also decided to pursue training as an attorney. So after medical school, I went to Stanford University Law School, and I am indeed a member of the bar, as a licensed attorney as well. So I'm an emergency physician and I'm an attorney. But I made my career in medicine, in emergency medicine, and I just did maybe a little writing on the side, policy kind of writing on the side. As I was very interested in health policies, one of the things that propelled me to get the education in the law. But in 2020, I was working in the ER and living in Los Angeles, which is a very progressive, which is another way of saying backwards city. But what I was noticing is that everything I was reading in the research and everything I was hearing from the coronavirus task force meetings that Trump and Fauci and Birx held, every couple of days was not matching what I knew to be factually true from a years of education and experience as a physician and the research that was coming out from all over the world. Remember, America was one of the last countries to really, be swept with the COVID pandemic, right? It was in China, of course. Then it was in Europe. When it came to America, it came to the East Coast, and I was all the way in the West Coast in California. So I had a lot of time to read and learn and become experienced. And interestingly enough, I'm an ER doctor. So for me, this was kind of exciting. I mean, I trained to handle emergencies and this was a medical emergency. So I was reading everything. And after a couple of months, I'd say, I knew about it a little bit in January of 2020. And then by March, things were revving up and people were gearing up for it to be, to really be a problem here. We had the 15 days to slow the spread and all those things. And we were having all these meetings at the hospitals. I was at 2 hospitals and she has been... We were having meetings in our hospital, how we would handle the flood of patients that were coming in. But what people were saying and what we were seeing was very different. Here's one of the differences. We were being told that hospitals were flooded and hospitals were overwhelmed, right? This was false. Now, some areas were flooded for a short period of time. So I did my training in New York, and there were parts of New York for about a month or 6 weeks that were overwhelmed. When you go back and you look at the Medicare data of hospital admissions and hospital ER visits, there were times it reached like 110 capacity, 120% capacity, but it was only for about 4 weeks at a time. That also happened in New Orleans for about 3 weeks. There was about 6 or 7 areas that for a limited period of time did have a surge that would have exceeded normal capacity, but it was very few areas and it was for a very limited time period. The overwhelming majority of the country, for almost the entire duration of this COVID mishandling event, was not busy. And I was in California and we were empty. In my entire career, I've never had that situation. People were being told not to go to the hospital, not to go to the doctor. You remember the lockdowns. Mm-hmm. So I knew as a doctor how dangerous this was. There's a ton of things that people have to go to the ER for or their doctor for. There's diabetics with wound infections. There's people who have to have their heart disease checked. There's, blood pressure and cholesterol issues and ulcer problems and diverticulitis and all sorts of things that have to be checked. And people were being told their doctors won't see them, right? And not to go to the ER. So for the only time in my career, the ERs were empty. The hospitals were empty. This is what propelled me to start speaking publicly. So I started going around hospital parking lots, and I had nobody on Twitter. I was a total private citizen, anonymous. I had maybe 100 people following me on Twitter. And I went to the parking lots, and I would hold my phone up and I'd say, look around the parking lot. There's nobody here, because I couldn't do it in the hospital. And you'd see the parking lots are completely empty. And as time went on, I became angry, right? Initially, I was willing to allow maybe this virus is unique amongst all viruses, totally different than everything else I've learned as a doctor. So I gave that a month or two. But after about 2 months, I realized it was all propaganda. The 6 foot social distancing was not true. Wearing a piece of paper over your mouth would never keep out tiny respiratory viruses that were zero point 0.1 micron in size. The pore size of the mask was about 1,000 times bigger or 10,000 times bigger. I forget the number now, but it was false. And I said, I have to speak out. So I started speaking out around May of 2020. And then I also started getting my first COVID patients, and I started treating them with early treatment. You remember hydroxychloroquine and ivermectin. And much to my shock, I knew the patient would do well. That was not shocking. What was shocking is my hospital threatened to fire me if I did that. One hospital refused to allow me to write prescriptions. The other one didn't have the capacity. It wasn't a closed system. So I write the prescription, but the hospital administration would find out about it and threaten to fire me. This was shocking.
That is shocking.
Experienced such a thing. Now, I'm a lawyer, and I was angry that a bureaucrat in Sacramento could essentially threaten my hospital. Like, I didn't know what was up, but I knew that the California state was threatening doctors. I knew that my employer was threatening to fire me. The state was threatening to pull my license, and the hospital was threatening to fire me. And this really galvanized me into taking action. I was angry as an American citizen. I was watching all around me. I was living in Los Angeles. People were giving up their constitutional rights. People were not assembling. People were not going to church. People were not speaking freely. And I thought to myself, if the Bill of Rights is collapsing in front of my eyes, I need to say something. This is what propelled me to find like-minded, independent physicians. We formed ourselves into a nonprofit called America's Frontline Doctors. And as you recall, in July 27th, 2020, we stood on the steps of the Supreme Court of the United States, and we told the world that the lockdowns are dangerous, that masks are not necessary, 6 foot social distancing was completely fabricated, early treatment was available if you should need it, and most importantly, not to live in fear. Now, we doctors did this outside of the media. I'm a small one-person physician with experience with other doctors. And I gathered what I called YouTubers, influencers, social media influencers. And that's what we did. That's all we did. We got 20 million views in 8 hours, 20 million views, broke whatever records are out for being viral. And then big tech took us off the air. Every big tech cooperated with each other. I'm saying Facebook, Twitter, Instagram. The website was hosted on Reddit, everyone, Squarespace, at LinkedIn. I mean, across the board from 7 to 8 p.m., I think it was, we were deplatformed across everywhere, which was very surprising and shocking to me that we were just speaking and that this happened. It so happened that 2 days later, I was in DC, of course, and we then were being inundated with media requests and people from all over the world, essentially. And I kind of blew up overnight, literally from a Monday to a Tuesday.
Yes.
Anonymous private citizen to being quite well known. And I would say half the nation was so appreciative and the other half was demonizing me. It happened that 2 days later, Congress happened to have been having a subcommittee hearing on big tech censorship. And they asked Mark Zuckerberg about me. They named me by name and they said, why did you take those doctors, off Facebook? And he, said something, we were saying dangerous things. And I remember thinking, this is incredible that Mark Zuckerberg, who I believe didn't even go to college, yes, he built a successful business, but who is he to tell doctors what they can say? I just was so angry. And of course he was wrong.
Yes.
Mission to save lives. And if you remember, for your viewers and listeners, if you watch this in real time, people were very struck by several of us. One of the people who really captured America's attention was my colleague, Dr. Stella Emanuel. So
Yes.
Stella Emanuel, you will remember, she's originally from West Africa, and she stood up there and she was so offended that we were killing people. She said, you need to give people this medicine because when they're dead, they're dead. I remember saying this, when they're dead, they're dead. They can't come back and fight with you about randomized controlled trial studies. And she was right. And she was very much demonized online, as was I. The good news was we were off to the races, and America's Frontline Doctors became very important over the next couple of years. We provided, or we made it possible for anyone in America to obtain early treatment medications, prescription medications, if they should want it. That was a very big deal. I'm very proud of that. I know that we saved lives due to those efforts, but my main focus was to make sure that COVID shots never became mandatory. Because if you think about it, remember back when people started talking about vaccine passports, and in Europe, they even started to have them. That is a version of what they have in China, which is a social credit score system. Mm-hmm. Are you complying with the government narrative? Are you being a good, quote, citizen according to whoever's defining the rules? So my focus as a doctor, lawyer, civil liberties advocate was to make sure the shots were never mandatory. So America's Frontline Doctors jumped into a lot of lawsuits to make sure that didn't happen. And I do think we influenced that. It's a tragedy as time has gone on that the shots have been proven to be as such garbage as we knew they would be. But at least we never codified into American law that, you must take these shots, because my biggest fear, David, was that such a kind of vaccine passport would kind of become part of American social fabric. And this would be the beginning of the end of freedom for all of us. So that was my fight for 2 to 3 years. And so that's what I was busy doing for the first couple of years of the COVID chaos.
Well, thank you very much for fighting for all of us, because, there were a lot of people that were afraid to speak out. But the question I think a lot of people, I guess, can't believe is that how can the medical industry work together and kind of shut down what was the truth? They didn't want you to use hydroxychloroquine. They didn't want you to use ivermectin. They shut you down for trying to give, actual information, truthful information. How did the medical industry coordinate this? Yes, I could see one hospital. I get it. But all the hospitals, the entire medical board, how did they do this?
Yes, it's actually a really insightful question. There's a few answers. I have lots of information on this.
Okay.
There's some macro reasons and there's some more micro reasons. Here are some of the macro reasons. Medicine has shifted to becoming a job. So my father's a doctor, and I grew up with medicine all of my life. Really, since birth onward, I've been exposed to the medical community. I would accompany him to hospital and nursing home visits, and we had an office in our home where he'd see patients in the evenings and the weekends. I know what medicine was like. And in my dad's day, 85% of doctors were small business owners. And that meant they worked for their patient. That supported the doctor-patient relationship. So the doctor-patient relationship was everything in my dad's day. Now, I started my training in the 80s and 90s. Every decade, I saw it shift and deteriorate and change. And the doctor-patient relationship has not been the primary driver in medicine for decades. This has come as a surprise to people because they're not in it, and they still have given us doctors the benefit of the doubt, thinking back to the good old days of the doctor-patient relationship, but it has not been like that for decades. Decade after decade, the interference in that relationship has been profound. In my day, right, so 5 years ago, let's say, doctors were now 15% of them were self-employed, and 85% of them worked for either like a hospital corporation or some other kind of big corporate structure. That's foundationally a completely different environment than 40 years ago. Doctors are no longer small business owners working for the patient. That's one thing. Number two, medical training, medical education, in retrospect, selected for and rewarded physicians for being very compliant with protocols. And then we did this protocolized medicine year after year. It got more and more and more. For example, in my work as an emergency physician, year after year, we would start getting instructions about how to treat patients that came in. You could look at this as a positive or as a negative. Maybe you say there's a minimum quality if you go down a checklist for somebody. But me, as a well-trained physician, I didn't need a checklist. And this protocol that I would be forced to go down often hurt people. For example, a person comes in with a fever. If I didn't give them antibiotics within 1 hour of their arrival to the ER, I would be financially penalized and my job would be threatened. So you learned to comply. There was kind of no way to push back. So we've had years and years and even a couple of decades of teaching doctors that they need to comply with the rules above them. That's kind of number two, is just that our training has done that. Number three, cancel culture has been so punishing for everyone, not just doctors, for everyone, because we have kind of worldwide instantaneous communications. Humans, of course, care about their reputations, but it's never been kind of like instantaneous, worldwide, and also permanent, right? You can't forget something that happened in the past. So to the extent that people are affected by compliance or peer pressure, that's now been tremendously magnified. When all this happened in 2020, you had doctors who were now employees, not working for the patient, but working for their own paycheck. You had tremendous social compliance of what the peers said, what your hospital administrator said, what the Sacramento said. And you had kind of a culture, doctors being a part of, that was very much listening to media. I think all of those things ended up coming ahead of the patient interest. If it helps, I want to share with you that I was shocked that so few doctors stood up for their patients. Because despite everything I've said, I do think being a doctor is a higher calling. I can't imagine not helping the human being in front of me. All of my career as an emergency physician, I helped many nice people, but I helped many not nice people. I've helped drunk drivers, I've helped murderers, rapists. I've helped people who were accused of child pedophilia. It would never occur to me not to help the human in front of me. That's my role for society. So I was stunned that so few doctors did the right thing. I'm not excusing it. I think they're going to be judged. But those are some of the reasons. And if I may say a couple of the micro reasons, depending on the state you were living in, we doctors were directly threatened. I don't think you know that. So for example, in California, I and all doctors, providers, received a letter in April of 2020 saying that if I prescribed hydroxychloroquine, I could lose my medical license.
Who sent the letter?
That letter came from the California Medical Board under Governor Newsom. There were several states that did that. And by the way, California was not the worst. Colorado, New Mexico were worse. Then this is also what propelled me to action, because I knew people needed this. And you probably know this, but I don't know if all your viewers know this. The reason I found this so offensive is because hydroxychloroquine is actually over the counter in most of the world. It's not even considered a strong medication most of the world. Most of the world considers it a vitamin. If you go to Indonesia, it's like in the vitamin section of the store. So I knew that hydroxychloroquine was incredibly safe. So to have a government bureaucrat, a government agency tell me what I could prescribe when that violated the law, I knew the law. A bureaucrat is not allowed to decide for me. If a drug is FDA approved, I, as a licensed doctor, am allowed to prescribe anything. This concept off-label, on-label, I'm happy to explain it to you, but it means nothing to a physician. We can prescribe anything that is FDA approved. And never in my career, never in my life had a government agency said I could get into trouble for prescribing an FDA-approved medication, let alone one that's considered a vitamin across the world. Yeah. It was shocking. I then heard of another doctor who was threatened by the government because he promoted vitamin D on his website. Now, I knew that if you got SARS-2 and were hospitalized with COVID, if you had low vitamin D levels, you did very badly. You ended up in the ICU and you probably died. Of course, it's proper to tell people to have good vitamin D levels. That's what he would say on his website, and the government went after him. This was very shocking, and these are some of the reasons that doctors didn't speak out, even if they were inclined to, as they were really being personally threatened.
What were they so afraid of with hydroxychloroquine and ivermectin? I mean, they came out with studies. Fauci came out, saying that this is going to kill you. I think the Lancet came out with a ridiculous study that it scars your heart and it kills you. What were they so afraid of?
We'll get to my book in a moment.
Okay.
But I just share with you. No, because I put in a whole chapter on this because even living through it, it was so perplexing, the hatred that was poured on hydroxychloroquine. From my perspective, before, I think it was March 17th, 2020, before Trump mentioned hydroxychloroquine, it was completely neutral. Nobody cared. And I know that because I was asking my peers. I was reading the studies from Italy and from China and from France that hydroxychloroquine looked very promising. So I would just kind of excitedly ask my ER doctor peers, what do you think? Nobody cared. Everyone's like, yeah, use it. Don't use it. We all knew it was completely safe. We had used it for years. Rheumatoid arthritis patients and lupus patients take it for decades. We all know that everyone can take it. Babies, breastfeeding mothers, the elderly, like everyone can take hydroxy. It's crazy safe, and it's been around for 70 years. And an early natural version of it is reputed that George Washington gave it to his troops, that it comes from tree bark, chloroquine, and it's just been around for centuries, if not eons. So all of a sudden, Trump mentions it on March 17th, and all of a sudden everybody poured this tremendous hatred on it. And it made no sense. I found out why. It took almost a year for me to find out what the hatred was about. When they rolled out the shots, if you recall, in December of 2020, the FDA said that the shots would be able to be rolled out. And again, that was my fight, make sure they're not mandates. And I think they were released to some people like December, January 21, by March to some more people. It turns out the shots were being released on what's called an EUA, Emergency Use Authorization Permission. What that means is you can't get permission to put out a medication to the public fast, bypassing years of safety data, unless there's an emergency and unless there's no other treatment available, right? Because that makes sense.
Right.
If there's an emergency and you need a medicine, but there's something else that's already been tested and tried and true for many years, of course you go with the tested, tried and true stuff. The government allows for an emergency exception if there's no other treatment available. So the shots were rolled out under this EUA, Emergency Use Authorization, which requires that no other treatment be available. That was the missing piece that maybe you didn't know, and maybe a lot of your viewers don't know, which is unless they poured hatred on this very safe, benign drug called hydroxychloroquine, they were not permitted to roll out the shots early. How do you like that?
So they knowingly, yes. I mean, they put everyone's lives in danger, actually. Because
yes,
I mean, if this was you told us that the hospitals were empty except for, certain areas. I mean, if everyone's lives was in danger, they actually decided, you know what, we're going to keep the cure from you, and we're going to keep that, off to the side while we roll out this, I call it a bioweapon, and they actually put everyone's lives in danger.
Yeah, for sure. I want to qualify something that you're saying.
Okay, go ahead.
Absolutely. They killed people. Like, you don't have to be shy about saying that. Governor Cuomo of New York murdered people, as far as I'm concerned. Fauci has blood in his hands. He's going to have to answer. But one of the tricks that they also played, which I'm hearing you're saying, it was actually not everybody. This was never a threat to the vast majority of people. Anyone could get sick with SARS-2. That's true. But the only people that did very poorly were people who were very frail to begin with. So, and the CDC had that data from the beginning. Children never did badly. And again, I say the word never, there's always a rare exception in the world, but children never died from this thing. They never did badly. They usually got very, very mildly ill, if ill at all. Elderly people with multiple comorbid conditions, typically 4, are the ones who succumbed. So you, as a middle-aged person or a young person or a healthy older person, were actually never really at great risk. Were you at risk of getting sick? Sure. Like you can get sick with any virus. Were you at risk of death? Absolutely not. Having said that, who wants to be sick? I mean, I made sure everybody I knew and loved had hydroxychloroquine at home. Of course. Yes, they kept it from you. Yeah. But the reason for keeping it was so that they can roll out the shots rapidly. They would have not been able to legally roll them out if there was a treatment. And by the way, this provision, which is, American law, is not in other nations. So other nations never poured the hatred on hydroxy that we did here.
It's just absolutely amazing. So they kept something that would help the elderly. I mean, I guess the young, like you said, the younger people, I guess if we didn't have any type of test or anything like that showing that we had COVID, I don't think anyone would really realize that we had it.
By the way, that's one of my fun, like this one, I sometimes lay awake at night and think, gosh, if they hadn't made such a big political craziness over this, would anybody have even reacted? Because for me as an ER physician, 15 years earlier, there was SARS-1. There's respiratory pandemics all, kind of all the time. Every few years we have them, but we just reacted so aggressively politically to this one. And you can wonder about that. It's above my pay grade. Was it all about the election in 2020? Whatever, but was this such a dreadful thing from my perspective as an ER physician? Absolutely not. I took care of many, many COVID patients. Overwhelming majority did really great. The ones who didn't do well were usually the diabetics or on dialysis or both. Those patients did very badly. Absolutely died. But But younger, healthier, younger people, middle-aged people, or healthy older people did very well. And by the way, these are the CDC's own numbers. I don't remember them exactly now. It's 2025, but it was something like without treatment, the young people did like 99.99% did well, and then middle age was like 98.7%. And it was only when you got to age 70 or 75, with no treatment at all, mortality was about 5%. That's with no treatment. That's with no hydroxy, no ivermectin. Another interesting thing, just because it's interesting, is COVID's actually biphasic disease. So it comes in two waves. So if you there's the early wave, which is the viral replication phase. And then if you knock that out, you actually don't go to the second phase, which is the really sick phase. So the point was to take these early drugs. That's why they call it early treatment, early, so that the virus stops replicating and it never progresses to the later stage. So, people needed early treatment. We knew it worked. We had, hundreds and hundreds of studies all over the world showed it work. That was all suppressed from you and from your audience. People sometimes said, how did I know? I said, because you could read. I mean, the studies were there. It's just that they were hard to find because they were being suppressed on Facebook and on, all the other platforms. It was a tragedy. Back in summer of 2020, when we told the world that there was early treatment available, back in 2020, there were 57 studies already from all over the world showing that it worked.
We're finding out today that most of the governments knew where it came from. It came from the lab in Wuhan, even though they lied to the American people and the rest of the world. During the time of COVID, I mean, what people saw, and as they were watching the news, because that's all they had to do because they were locked in their house. All they saw was the count of how many people were dying in the hospital. I mean, it was ridiculous. It was like a counter at the bottom of the screen, and that's all people saw. And they're like, oh my God, everyone's dying. Everyone's dying. So were there that many people dying in the hospital?
No. So what bothered me so much about that kind of propaganda, there's multiple kinds of propaganda. Think of the concept. There's the concept of omission bias. Omission bias is when you're biased to believe something because a lot of data is missing. We saw this on January 6th, and we saw this during COVID. So this is like Geiger counter at the bottom telling me how many people are dying. Are you able to tell me right now how many people die a day in America? We're a nation of 350 million. We never kept a death count, on top of the news. It was a numerator without a denominator. It was a numerator without any context for how many people normally die. I knew there was not increased mortality. I knew this. That was a very difficult number to sleuth out from Medicare data. But when you go back and look, it does not appear there was even excess mortality in relationship to COVID. The average age of death from COVID was after average life expectancy. I think life expectancy for men was maybe 77. I'm not as familiar with these numbers as I used to be. But the average age of death was something like 78. It was like 6 months older than the average life expectancy for man, right? So were they telling you this? I mean, the omission bias, the omission propaganda was overwhelming. One of the good things to happen after COVID is I do think people lived through and directly experienced so much lies that they are more skeptical now of when people in government tell you things. For example, many, many, many people took the shot. We knew, separate from the shot not being safe, which is true, we actually knew it never stopped transmission. We knew that because it said it in the Moderna and the Pfizer applications that they submitted to the FDA. Like, this wasn't a secret. It was in the paperwork. We knew it didn't stop transmission. And we were screaming that from the rooftops, but we were being censored, right? But so many Americans took the shot, got sick again, and their neighbors got sick. That they know that they were lied to. And in a way, that's a good thing, because people needed to experience that they were being lied to. And now they believe people like me and like you because they've directly experienced the lies.
You know what I couldn't believe during that period of time when people were taking the shot? I mean, normally when you go to a doctor, they, what medication you're on, they look at your chart, they see, what illnesses you have. But everyone was rolling up in their car, sticking their arm out, and they were getting this shot. And you didn't have your doctor there. They didn't have your medical records. They had nothing. And everyone was just getting it without even saying, oh, wait, you're on blood thinner. Oh, wait, you're on this medication. I mean, how did they know that this wasn't going to affect something else?
You are correct. And I'm going to say it, like you said, and perhaps a little stronger. we doctors are supposed to be risk averse. I mean, we're really paid to be risk averse.
Hmm.
We're the ones that tell you don't drink too much, don't eat too much, go to bed at night, be careful with your friendships, don't have toxic relationships, don't sleep around. I mean, that is a doctor's job. We tell pregnant women, don't smoke, don't have a sip of wine, don't even have a bite of sushi. That's what we doctors tell people. Don't bungee jump. All of a sudden, we were saying to pregnant women, roll up your sleeves and take the new stuff.
Yeah.
How not only am I offended as a woman, as a physician, as an American, but I'm baffled that doctors themselves didn't even realize how propagandized they were to be speaking in a way that they hadn't spoken their entire career. I've never in my whole career seen a physician give a pregnant woman something new. And the data already showed that, women of pregnancy age never died from this thing. I mean, to this day, it remains baffling to me how doctors justified this, nurses justified this. Nurses were better than doctors on this, I will tell you. Perhaps because nurses spend more time with patients, but overall, as a profession, the nurses did better than doctors.
But what do you mean the nurses did better? What do you mean by that?
Overall, I don't think the doctors were very bad. I'm just guessing, nobody knows, perhaps 10% of doctors that resisted the propaganda. The nurses by profession have to follow doctors' orders, so they're not at liberty to not carry out the orders. But amongst themselves, because in an ER I worked with nurses a lot, amongst themselves, they didn't believe this the way that doctors did, which is interesting. And this is when you asked me in the beginning, like why so many people complied. I do think doctors in our medical training system are selected specifically and rewarded for being very compliant. It's a big failing in the medical training system that I didn't think about until a few years ago. And again, I have the luxury of also being an attorney, and I know how the training is different. I literally lived both. The medical training is very memorization and regurgitation and reward for being able to do that very well. Law is you have to read and analyze, and then you have to know that, but you are actually rewarded if you come up with a creative idea, or at the very least, you have to hold in your head multiple opposing ideas at the same time, right? If you're reading a Supreme Court justice decision, there's always multiple opinions there that different justices have written. And if you're an excellent attorney, you're able to hold in your head multiple arguments. So the training is very different and they reward for very different things. I do think that's part of the reason why doctors were so compliant. And it was just nurses don't have to go through such kind of regimented, protocolized thinking quite as severely, is my guess.
Since you came out and you spoke out against this, have they gone after your medical license? Have they? I think you were thrown in prison, right?
Yeah, it's so I would say for 2 years, maybe 3 years, I felt a tremendous urgency to spread this message to the public. It's almost like a religious urgency. I just felt they were killing people and people needed to know. And everywhere I went, people were so grateful. Their eyes are tears are pouring down their face. And I knew I was making a difference. So everywhere I could speak, I spoke. And it just so happened that I was invited to speak at the Capitol on January 6, 2021. It was one of 4 speaking engagements I had that week. 3rd, 5th, 6th, and 10th. And on January 5th, I gave the same speech I was planning to give on January 6th. But January 6th, of course, did not go as planned. And I ended up being swept in with the whole crowd inside the Capitol. It's very interesting how this all went. There's video of the whole thing. It's all documented. But I was there doing my thing, which is I was giving a health freedom speech and telling people not to be afraid. And there's early treatment. Same thing, I've been speaking on for like 9 months at that point. And that was it, quite frankly. And of course, it's ridiculous, but I'll say the obvious. Of course, I'm not violent. I was walking between the ropes, very, calm. And that was my experience in the Capitol on January 6th. Of course, the government went after anybody who was present on Capitol grounds on January 6th. And the next 4 years were unbelievably punishing to me and about 1,500 other of your brothers, sisters, uncles, wives, parents. I mean, what the government did to people who were present on January 6th is shocking, it's chilling. It's most analogous to what our federal government did to Japanese Americans in the 40s, where they put them in internment camps. Our government, our federal government, took politically conservative Americans and they really destroyed their lives. I was more famous than most. However, people lost businesses, they lost their marriages. I personally, I think all of us, I'm not sure all, but all or almost all of us endured very violent FBI raids that were very scary. 20 officers in tactical gear and bulletproof vests and huge weapons pointed at me with the red laser sight beam on my chest, threatening to kill me if I didn't like immediately react. And it was shocking. My home front door was beaten down with a battering ram. And I'm watching all of this unfold to me. I'm a doctor, I'm a lawyer, I'm a mom, I'm an American citizen. I, of course, have no violent history, no criminal history. I've never been arrested, never been accused of anything. How did our government send an FBI raid on me worthy of El Chapo? Like, how did that happen? This is why I wrote the book, Selective Persecution, the legalization of American fascism, because things like this couldn't just happen unless there was a bit of an infrastructure to fascism already in our nation. The officers, the FBI agents who came to arrest me that day, these are just regular, working officers who were themselves being told things that were not true, but with their own eyes, they're seeing that what they're doing isn't matching what they know they should be doing for SWAT team arrest. SWAT team arrests are ordered when there's a history of violence, criminality, gang affiliation, drugs, reason to be concerned for safety, right? That's when you order a SWAT team arrest. The officers sent to arrest me were part of the retraining of American psyche. These are not officers who thought I presented any danger. This is the theme that I'm exploring in this book because I want people to realize that the nurses and the doctors in the hospitals that are not doing the right thing for their patients, and the officers who are arresting in a very violent way people like me, and later my experience in prison, the prison guards who treated me sadistically, this is not happening as one-offs. There's something going on, an undercurrent of tyranny that's already been kind of institutionalized already throughout our system, our American way of life. And it was pretty invisible to me as a private citizen 5 years ago, but I've now lived through it. I've lived through Congress coming after me. I've lived through the California Medical Board trying to take my medical license, the New York State Bar trying to take my law license. I've lived through going to jail. I've lived through a horrific arrest. I've lived through these things. And so I explain through these experiences things that I think Americans need to absorb and learn as part of our culture. But I do it in a very, very, interesting, readable way. It's my life. I mean, this is my life. This really happened to me. I really was, for example, one of the stories I share, I was in a situation where the government tried to plant narcotics on me. Like
Really?
literally, I'm a doctor. They tried to plant narcotics on me and I have it on video. And the government essentially denied it, and I have it all on video. I mean, it's like a John Grisham novel, what I've endured the last few years. So you'll enjoy it and you'll learn a lot. And I don't think people will be like depressed when they read it. I think they'll feel empowered because there's still so much good that can happen, because when you see stuff like this, you then can learn more about our system and become empowered yourself. I mean, that's what happened to me. If anybody thought that everything I went through was going to make me weaker or stand down or not speak up, it's had the opposite effect. And I think it'll have the opposite effect on readers too.
So let me just ask you about the bird flu and measles that we're seeing today. Is the bird flu dangerous? Is measles dangerous?
Yeah, I love this question because my heart is with helping people. I'll be a doctor till my last breath. So I just briefly mention, I launched a business 2 years ago called Gold Care, Gold, my last name, goldcare.com, to answer these questions for people. No, bird flu. We'll do bird flu and then we'll do measles.
Okay.
There's so much medical propaganda out there intended to frighten people into taking actions that give up their own rights. So the governor of California declared like a bird flu pandemic. They killed all these chickens. The price of eggs went through the roof. Was this necessary? It is not necessary. There's no human-to-human transmission of bird flu. The case that led to Newsom taking those emergency powers to himself was one man had died in Louisiana. This man happens to work with sick and dead chickens and birds. Like that's his career, that's his work. So if you want to know more about such issues, the reason I mentioned Gold Care is it just so happens about 4 months ago, we did a whole town hall on bird flu because we want people to have that information. And next month, we're doing another medical town hall. It's open to the public. It's free. Goldcare.com. Just look for the town halls. Next month will be on measles. It's very similar. Perhaps some of your viewers remember the Brady Bunch episode in the 70s, I suppose, where the kids all came down with measles and they were happy because they got time off from school and that's what measles were. And so the incidence of measles plummeted. This is new information for people. It plummeted prior to the MMR shots being released to the public. By the way, I had all these shots. I was never in the vaccine fight prior to COVID. Just people want to know my background. But it turned out that the incidence of measles had already plummeted before the MMR was released. But people who are older, your grandparents' age, will remember that measles was not that big a deal. And that doesn't mean there weren't exceptional cases where people did badly, but overwhelmingly people did just fine. But they have people so worked up into a panic in such a state. It's uncalled for. And it's also by numbers, it's not even worse than it's been in other years. So there you go. I just want to say, although all the proof isn't there yet, it is clear that these COVID shots weakened people's immune systems. So I believe this kind of propaganda over various viruses is just going to continue and get worse and more frequent. So remember last year we heard about RSV, bird flu, measles. We're going to keep hearing about this. And to the extent that there's truth behind it, it has to do with people's weakened immune system. So taking these COVID shots weakened people's immune system. That's part of the problem. But in general, you just need to be healthy. You need to eat well. You need to maintain a safe weight. You need to move your body every day. You can't get away with being a couch potato all your life. You need to have a good immune system, and then you need to not worry.
Great. Thank you very much. Dr. Gold, thank you very much for being on the X22 Report Spotlight. If people wanted to get your book, where should they go?
Absolutely. I urge you, please. I'm just going to ask you to please pre-order it. You're never going to read a book like this. Selective Persecution. Pre-order it at Amazon. The pre-orders help, whatever the algorithms are that they use. And it's just a fascinating read. Pre-order Amazon, Selective Persecution.
Great. I'll put all the links at the bottom of the video. Once again, Dr. Gold, thank you very much for being on the Spotlight. I really appreciate it. Thank you very much.
Thank you, David.
Thank you.